I don't even know where you start if you're new to the country, whether you're a refugee on a work visa or have decided, this is your new home. How do you understand the system with EOBs and pre-certification and co-pays and deductibles and all those other things? It's a lot to know.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
We are so pumped to have Abby Grainge here with us today. Abby is a family nurse practitioner at Jericho Road Community Health Center and the medical director at Vive, Jericho Road's shelter for asylum seekers. She joined Jericho Road in 2018 as a nurse practitioner with hopes to provide a holistic model of care for her patients. She strives to integrate healing-centered care as she treats pediatric, obstetric, and adult patients throughout their lifespans. In 2011, Abby received her Bachelor's of Arts degree in Philosophical Theology and then went on to pursue a career in nursing. She holds a Bachelor's of Science degree in nursing and a Master's of Science and Family Nurse Practitioner degree from Duville University, formerly Duville College. As she pursues her postmaster's Psychiatric and Mental Health Nurse Practitioner degree from the University of Buffalo, she is dreaming of a world where trauma-informed mental health care is accessible to everyone, especially to our most marginalized neighbors here in Buffalo, New York.
That's a lot. Welcome, Abby.
Oh, thank you so much for having me.
We are so glad to have you on the podcast. And after hearing the bios, we want to talk to you a little bit about unique barriers to care that people face when they're coming to the United States or when they have a language barrier and English is a second language for them, and sort of that comprehension that they need when accessing and seeking care for themselves and their families. And you seem like the perfect person to help us with this conversation.
Well, I hope I can help you guys. I mean, I think that we should just start from the beginning because that's really what a lot of most of our refugees and asylum seekers, that's where they start, right? They come not knowing the language. I mean, some know parts of the language or know the basics or conversationally, but they definitely are not fluent. So they have on their mind that they want to learn English. Most of them come with big families and they are focused on their children, getting them in school. So everything from, going for their routine physicals, getting their immunizations before they can even start the process. It is a huge barrier. I should have even mentioned before, like getting and obtaining insurance. It depends on like what status a refugee or asylum seeker comes in with. So it's a little bit nuanced depending on their status and how they can get insurance, but most come in without any at all beyond primary care. Some people come in very sick. They've not had, the care that they've needed for years and years. Some people get their medications and all of their medical records confiscated at the border. This is especially true with asylum seekers. So, they're starting with nothing. They're starting from the beginning. I mean, I guess I don't know how to expound more because there's just so many things to know and to learn to get to the point where, they feel like they understand even an ounce of what the healthcare system is like here.
100%, because I was born here and English is my first language, and there's a lot I don't know. So I don't even know where you start if you're new to the country, whether you're a refugee on a work visa or have decided, this is your new home. How do you understand the system and overcome a language barrier, learn sort of the terminology even that we use to explain how to use the healthcare system with EOBs and pre-certification and co-pays and deductibles and all those other things. It's a lot to know. It's a lot to know.
Absolutely. And I think that it's kind of one of those things, you don't know what you don't know. And they're faced with this time and time again, when they come in and they expect, from a primary care setting for us to be able to give them everything they need right away. And, it's a lot of conversations around this will take time, a lot of promises that we'll do our best to get you connected with the specialist and the care that you need. But, just kind of explaining that, it's the United States, but we also have a broken system as well. We have broken systems. So
are they assigned a case manager or somebody that they come to the shelter, they meet with somebody? What's like step one?
So if we're talking about refugees coming in, yes, absolutely. They're assigned to a case manager before they even arrive. And that case manager, we subcontract with other agencies like Journey's End in the area, Catholic Charities, and they're kind of in charge of getting them set up with jobs, with housing, with medical care, getting the kids in school. And there's a certain amount of time, I think it might be somewhere between 8 to 12 months where that case manager is there for them, kind of to be a liaison, to navigate everything, not just healthcare, right? When asylum seekers come, however, they have zero support, like nothing. They come and they knock on the door at Vive and they say, I need a place to stay. I'm seeking asylum, whether it be in the United States or whether it be in Canada, and they're just passing through transiently. They need all the support that they can get. Now, Vive has several social workers, a robust legal team. There are support there, but there has to be an opening for them to stay. And one thing we're facing now with all of the new changes with immigration and, everything at the border, like we're overwhelmed. There's people, I saw a patient yesterday who's on a waiting list to stay there. So, he's staying with friends or whomever he can find until he a bed opens up. And that's an additional barrier. So once they get in the door, there is, a systematic approach where their legal documents are figured out and, they see myself or another physician colleague who does the Vive clinic. And at that time, we do the basic medical care, but there's a lot beyond that. So
what do you enjoy most, Abby, about the work that you do?
So many things. I mean, this job is hard. And I think that that's true in healthcare, like you guys know, and whether you're working in a hospital or a clinic, and, it doesn't really matter what population you're working with, there are, system problems that, you have to go up against. I experience those every day. And I've definitely had to work it out of what I choose to be stressed out by and what I decide, that's not my problem right now. I'm here with the patient and this is my number one priority. So, I mean, I think all that to say is the patience and the relationships that I've been able to make with people, throughout the years is just, it's so humbling who they're just hoping that in Buffalo, they're going to have opportunity to give education, to give it, a chance at a good life. And they come in and they're excited to be there, but they're also overwhelmed by their journey that they've just endured, some for over years, some walking on foot, bus, you name it. They've experienced so many hurdles, and they're here and they're sitting in the room and you're speaking with them, and they smile as you explain, I'm here to help you out. This is what we're going to do. Welcome to the United States. I've had experiences where a mom will hear her baby's heartbeat for the first time, and just seeing that joy on her face is just, it's unexplainable. To sum that up, it's the relationships that are my favorite part, and seeing them grow as people, as new Americans, all of that.
That's amazing. I can only imagine. And it makes us feel very fortunate too, that we have no idea, when you really think about it, the journeys that they've been on and what they've seen. So it's a pretty incredible.
So what do you think from what you do in your day-to-day job has helped you to become a better patient or navigator of the healthcare system in the United States? What do you know that you wish other people knew?
These people at the end of the day are just trying to live and make a life for themselves. And, around healthcare, there's so many other barriers. Like, we get in the mail. I mean, my husband just had surgery and he gets tons and tons of bills, based on our deductible. And I don't understand it. Like half the time I'm trying to interpret it. And, like you said, Sarah, like my first language is English. I grew up here. I understand how it should work. And so, imagine these people coming in and they're getting all this mail and, they have no idea what it says because they don't read English, and they're seeing numbers and they're getting even more anxious, on top of everything that they have to deal with at baseline, all the trauma that they've experienced. They're just wanting to know and wanting to have the help and guidance. I mean, I even had a patient yesterday show me this letter that had nothing to do with her medical care, but she thought it did. And she's like, can you read this for me? Can you interpret? Can you tell me what this is? And that happens all the time. And that's just an example of the immense hurdles that, every day.
So could you talk to us a little bit about some of the services that your organization provides to help people navigate healthcare and health needs?
One other thing that is like really important for us specifically at Jericho Road is our interpreters. Of course, we have access to a translator phone, but it's like, it makes a world of difference to have a live interpreter in the room. Someone who's from the community that patient's from, who understands the cultural barriers and the cultural nuances, and, also understands the system and how it works, specifically in Buffalo, but also at Jericho Road. Yeah, I definitely don't think I could do my job as quickly or as well without our interpreters.
Well, I think overall, it's incredible to know that there's people out there who can help, especially when you're coming into this country, where English is not your first language and you're dealing with a healthcare delivery system that is broken and confusing. Well, thank you so much for joining us and providing such great insight into that world. We certainly appreciate it.
Well,
Yeah.
Thank you. Thank you both for having me. I really appreciate your time.
I think it's interesting to have another perspective on the healthcare system, because sometimes you feel strange looking at it from where we are, and it has to be an even more difficult experience when you're new here. So thank you for the work that you do, and thank you for joining us.
And thank you both.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR_the-coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.